Hi, this is my presentation on full practice authority for advanced practice registered nurse in Kansas. Full practice authority, or FPA, is the authorization of APRNs to evaluate patient, diagnose, order, interpret diagnostic tests, initiate, manage treatments, including prescribe medications without a physician's oversight. First states to grant FPA in the 1980s include Alaska, New Hampshire, Oregon, and Washington. Currently, 25 states and the District of Columbia grant APRNs FPA. Veterans Affairs Healthcare System passed the law in 2017 granting APRNs FPA. APRNs in Kansas have attempted multiple times to gain FPA without success. Multiple bills in Kansas on FPA have been introduced to both the House and Senate, but most of them died without a vote or failed to pass. The latest Senate Bill 174 and House Bill 2256 were introduced in January 2021 by Kansas American Association of Nurse Practitioners. Senate Bill 174 was sponsored by the House Health and Human Service Committee, and House Bill 2256 was supported by the Public Health and Welfare Committee. Both Senate Bill 174 and House Bill 2256 had hearing in February but failed to pass. Of course, there were supporters and opponents to the bill. The bills were supported by APRNs and others from Kansas American Association of Nurse Practitioners, Kansas Advanced Practice Nurse Association, Associate Director of Legislative Affairs, National Council of State Boards of Nursing, Kansas affiliate of the American College of Nurse Midwife, and AARP advocacy volunteer. And those who opposed the bill include physicians, physician assistants, and American Medical Association. Stakeholders include APRNs, physicians, patients, National Academy of Medicine, Institute of Medicine, healthcare corporations, and healthcare insurance company. Physicians who are interested in the bill believe APRNs have the abilities and capabilities to practice independently and should be permitted to practice to the full extent of their education and training. Healthcare insurance companies, nurses, and patients who support the bill consider APRNs deliver cost effectiveness and holistic care. A study suggests APRNs provided more holistic care than physicians. Patients were satisfied with APRNs, and APRN's professional experience outweighed provider type. Benefits of FPA. FPA increases access to care, especially in underserved urban and rural areas. States with FPA are more likely to have APRNs working in rural and underserved communities. FPA provides patients with full and direct access to the APRN services at the point of care and avoid delays in care. FPA reduces costs associated with duplication of services and billing associated with physician oversight of APRN practice, and eliminate unnecessary repetition of orders, office visits, and care services. FPA allows patients to see the healthcare provider of their choice. No one will be adversely affected by FPA. It takes time and it can be costly to pass FPA bills into law. The cost includes hiring lobbyists to lobby the FPA-related bills. Most lobbying companies charge $1,500 to $5,000 per month or more for full advocacy services. APRNs can become a member of nursing association or organization to support FPA-related bills. It can be time-consuming to influence the state representative to support FPA-related bills. If APRN gains full practice authority, APRN can work independently without collaborative agreement with a physician. APRN can open their own healthcare clinics. APRNs will gain more prescriptive authority to include prescribing controlled substance without physician's oversight. And APRN can provide cost-effective and holistic healthcare. Recommendations for change. APRN need to be involved in policy and politics. They need to connect with policymakers to help advance bills related to FPA. They need to write to Kansas representatives to support bills related to FPA. They need to communicate with the media to make APRNs more visible and recognized. And they need to join nursing association or organization to support bills related to FPA. And these are the references. Thank you for listening to my presentation.